Hello everyone, myself Raviranjan Kumar. I am physiotherapy student. So in the part of electromyography, the next part is to be in this video. So what is that? It is motor unit action potential. So what is the meaning of motor unit action potential? The electrical signal or electrical supply is generated by the neurons of the skeletal muscle, which is have to be one muscle or the group of either group of the muscle, is to be recorded on electromyography machine or shown in the electromyography board is to be motor unit action potential. So what is the definition? The electrical signal generated by all the muscle fibers in a single motor unit when they are activated by motor neuron. The motor neurons generated by the electrical signals and in the single motor unit and in the spinal cord, they can shown on the electromyography. So what is their origin? Generated when motor neurons sends the impulse. It will be happen when neuron send to the signal of the skeletal muscle, transmit along the axon neuromuscular junction. It will be like where we found the electrical signal, the junction of the neuromuscular, where the neuron on the muscle will be junction, and where we can found out the electrical signal, depolarize the muscle fiber and recorded by the EMG. So like polarization, there is a negative charges inside and positive charges outside. Where is depolarization, there is some stimulus came and the influx or efflux of the positive and negative ion, and the next part is to be depolarization and repolarization. The signals will be shown on the graph. So what is the components of the motor unit action potential? So there is a component and here is description. So what is the amplitude in the motor unit and action potential? The height of the potential reflects number and size of the fiber in the motor unit, like normal 200 volt to 300 millivolt, increased in the reinnervation, decreased in myopathy. It means like motor unit action potential, there is a like height of the potential reflect the number of the size fiber. It means how many number of the fibers of skeletal muscle will be produce the signals of the electrical. It will be normal to be 200 microvolt to 300 millivolt. It will be reinnervated in the myopathy or in decreased in reinnervation. So what the duration we have to find out the skeletal muscle produce a motor unit action potential. The time of the initial deflection to return to baseline normal to 5 to 15 minutes second, prolonged in a neuropathic condition due to the reinnervation. It means the normal muscle fiber we have taken them in 5 minutes, but in prolonged neuropathic condition. So what is the phases? Each time the waveform crosses the baseline is phase normal to be 2 to 4 phases, polyphasic or more than 4 phases is polyphasic. See in reinnervation in myopathies, it means we have studied in the 4 phases in previous lecture. So there is a different phases have their kind of different waveform has to be like shown on the demographically on the screen of the electromyography. So it will be in 2 and 4 phases. They have crosses the baseline and shown the waveform in the different muscle of the skeleton. So what is the rise time? The time taken to reach peak amplitude from the baseline normally is greater to 300 microsecond. Increase in fiber loss the asynchronous firing. It means the firing rate of the contraction of the muscle is to be shown on the electromyography is how much, like 300 microsecond is the like ideal value we have shown on the electromyography. So what is the firing rate? The firing rate is at which motor unit are activated during muscle contraction. Normal increases with the stronger contraction reduced in the neuropathic, early in myopathic disorder. It means the motor unit activation during muscle contraction, like motor unit whenever activated, the contraction of the muscle will be happen on that place. So normal increases with the signal will be came into CNS, and the stronger contraction we have shown that we have shown in the like cerebral palsy. We have taken an example. The spastic muscle we have contraction. The firing rate is to hard. The firing rate is to be strong. So in this condition, there is a rate of the firing is to be too much. So the contraction is also be too much. So there is a neuropathic condition. So configuration, shape or pattern of waveform, they reflect the fiber of the arrangement and conduction properties. So we all of the data we have shown on that place, we can configure out or figure it out, and we can understand like different waveform we have shown on the electromyography, how it can be like prognosis of the patient will be like happen or not during the treatment protocol followed or implement on that patient who have suffered from neuropathic or neurologically or myopathic disorder. So that is the components of motor unit action potential. So our next part is spontaneous abnormal potential. So there is a part of the electromyography, there is abnormal potential found it out. So abnormal potential found in fibrillation potential. So what is that? The description appearance, like fibrillation potential is a regular spontaneous discharge of the single muscle fiber, small spikes. It means sometimes in neuropathic condition, like some case, like reinnervation times, some like nerve spikes the 20 to 300 millivolt at the same time firing rate, but sometimes it will be abnormal. So seen in denervated and myopathy like conditions. Positive sharp waves. It is shown on the denervated and polymyelitis. Like polymyelitis have more than four phases have shown in the electromyographics that data. The initial positive downward and the deflection followed by the slow return. It means they can spiked out. It can be spiked out initially, and it will be deflection followed by the slow return. It will be spiked out initially and very fast, and will be slow down. It will be deflection. Like it will be degenerated nerve and fibers or skeletal muscle. So what is the fasciculation potential? It is irregular firing of the whole motor unit. It is a visibly muscle twitching. Like whenever we have on a like protocol follow in the twitching or like we have shown on the like dry needling we have taken and we have inserted into the body. So like they have muscle twitching, find it out. So there is a no like do no is a firing rate will be like came in around into the CNS. So there is sometimes will be came, sometimes will be no can. Like it will be happen to UMN and LMN lesion. So it is a motor neuron and peripheral nerve disease both of them occur. So here I can see seen in the motor neuron disease and peripheral nerve disease will be both will be happening in this case. So myotonic discharge, what is that? The die bomber sound, waxing and waving amplitude frequency. It means whenever we have inserted the fine wire onto the skeletal muscle, we have shown that there is a die bomber sound on that place. So it means there is an abnormal sound of myotonic. So it is happening on the muscular dystrophy or myotonia congenita. So complex repetitive discharge, what is that? Is the meaning repetitive regular firing of the group of muscle. It means like in cerebral palsy or chronic neuropathy or myopathic disorder, there is a continuously firing rate will be occur or muscle will be going to the spasticity. And here you can see in chronic neuropathy and myopathic disorder, as we can know. So end plate noise potential, what is that? So if have shown in the like low amplitude or irregular potential in neuromuscular junction, there is a sound of end plate and there is some noise abnormal. So you have finding near to the end plate and region. So what is their indication? So where we can use in EMG machine. So peripheral nerve injury like radial, medial or ulnar palsy, nerve root lesion like reticulopathies, motor neuron disease like amyotrophic and lateral sclerosis, myopathies like muscular dystrophies and polymyelitis, neuromuscular junction disorder like myasthenia gravis. So this is the EMG. And the facial nerve Bell's palsy involvement, carpal tunnel syndrome or tarsal tunnel syndrome, brachial plexus injuries, post-traumatic nerve regeneration follow-up, contraindication of EMG where we cannot use of electromyography. So patient refusal or inability to cooperate. It means patient is not available or not like in the mind of doing this therapy. So we can't do this therapy on the patient. Local skin infection or inflammation of electrode site, like they are suffering from bacterial or like viral infection on that place. So we can't use on there is an inflammation traumatic condition and like redness, swelling and loss of function on heat on that place. So we can't use electromyography on that place. Severe bleeding disorder, risk of hematoma like over bleeding and hematoma kind hemorrhagic condition after the like road traffic accidents, for not use electromyography on that place. Severe bleeding disorder like relative contraindication, like patient on anticoagulant therapy. It means there is a have like suffering from like coagulant therapy and take a medicine of anticoagulant. So we can't insert the fine wire or like needle on the patient for checking the EMG. Presence of pacemaker or defibrillation, like pacemaker as well not present on the heart. So we can't check of EMG where is in like burning and the like neuropathic lesion can be happen on that place. So presence of pacemaker, a severe edema or lymphedema at the site. There is a like accumulation of the water content on display on that place. So we can't use EMG machine. Recent surgery near the test area, any kind of surgery like TKR, like total knee replacement, total hip replacement, partial knee replacement, partial hip replacement, any kind of abdominal surgeries. So we can't use an EMG for the kind of any abnormality will be found on that place and happen, not it. So we can't use EMG. Compromised immune status like risk of infection. So it will be happen for we are used like day by days or like patient to patient. So we can maintain a hygiene or like disinfected of the fine wire or like surface electrode where we can use with the patient to patient. So what is the normal finding on the EMG? So resting muscle electrically silent, minimal contraction, single motor unit potential, like gradual contraction, order to recruitment of additional motor action potential, maximal contraction, full interference pattern will be shown on that place. Thank you.